Welcome, my name is Kathy Armitage and I am the Active Lifestyle Program Director at the Platte County Community Center South YMCA. Today I'm here to talk about National Fall Prevention Day, which lands September the 21st through the 25th. One of the topics that we are currently going to discuss is medication reviews. Today I would like to introduce and welcome a very good friend of mine, Dr. Celtina Reinhert. Welcome, Celtina.
Hi, my name is Celtina Reinhert. I'm a doctor of pharmacy and a local Price Chopper pharmacist. I'm here to share with you about the risk of medication and the risk of falling. What we call when people are on multiple medications is called polypharmacy. Typically the definition is 5 or more medications, and about 60% of adults over 65 years or older use 5 or more medications on a regular basis. Increasing the number of medications increases the risk of drug interactions and increases the risk of falls, especially as people get older. Common medications that increase these risks are medicines for anxiety, for sleep, for depression, for seizures, and other mood disorders. Chronic use of pain medicine can also increase the risk of falling. The reference for medical professionals for medications known to increase problems for older adults is called the Beers criteria. It was developed almost 30 years ago and is updated every few years by the American Geriatric Society. It's designed to be used as a guide for medications for adults who are 65 and older, along with your doctor and other healthcare professionals' clinical judgment. Some medications can cause what we call orthostatic hypotension. What that means is you get a blood pressure drop when you go from sitting or lying down to standing up. This can cause a potential loss of balance and increased risk of falls. Other medications that affect the central nervous system, things that cause drowsiness, are especially problematic. One that comes to mind is over-the-counter Benadryl. It's in most over-the-counter sleep aids, things like Advil PM, Tylenol PM, Unisom, NyQuil. It's an antihistamine. It's what we call a first-generation antihistamine, and it commonly causes drowsiness. It's problematic when in the middle of the night you get up to go to the bathroom or in study because it causes drowsiness, and you wind up on the floor. For a while, we also thought vitamin D helped increase muscle strength and reduce the risk of falls. Right now, we don't think that's the case in people who have adequate vitamin D levels. I wouldn't recommend taking vitamin D for the sole reason of reducing the risk of falls. However, if someone has osteoporosis or low vitamin D levels, I would consider supplementing with vitamin D in those cases. I recommend highly to everyone, especially adults as they age, to discuss with your pharmacist all of your medications, your prescription, your over-the-counter medications, your supplements, and your vitamins. That way your pharmacist can help check to see what medications may be on the Beers criteria list and to see what potential for interactions with each other they have in increasing the risk of falls. Thank you for your time today.